DL is a 60-year-old patient who calls your front desk wondering if he should come in. He's feeling ill, has a low-grade fever and a cough, and he's worried he's been exposed to the coronavirus. Hi, this is Frank Domino, and joining me today to discuss the coronavirus is Dr. Robert Baldor, professor and chair of UMass Baystate at the University of Massachusetts Medical School. Good morning, Bob.
Morning, Frank.
So instead of us covering all the epidemiology on COVID-19 and the coronavirus, I feel like maybe you and I should just talk about what we know about how to handle common occurrences like DL's questions. He calls up and he's got a cold. What should we tell him to do? Should we bring him in? Should he wear a mask? Should we send him to the lab? Should we call the CDC? What should we do?
Yeah, good questions. I do want to start by saying that right now that this coronavirus is out there, and the CDC website is terrific. People should just go to that to find guidance about a whole host of questions. The problem with a virus like this is that it's a novel virus, so there's no immunity out. There's no herd immunity out there. We have no vaccine for it. So the last and the people who are really struggling with this or dying from it or having severe disease from it tend to be the elderly, the immunocompromised in some fashion. So the last thing you want to do is have somebody who has this or you suspect of having it coming into a medical arena where there are people who are immunocompromised. So some of this is like, well, people need to be seen though who are sick. And so this is a little bit teasing out what is the likelihood that they actually have coronavirus. Did they actually travel to an area and so on? Were they in China or in Italy in the last 3 weeks? And if they weren't, unlikely that they've got that exposure. But the problem is, I actually talk about this as a perfect storm. This is a medication, this is a disease we really don't have any great prevention for. We don't have any great testing for, and we don't have any great treatment for. So, wow, we're sort of stuck with this as we go along. So given all of that, people who are getting sick though, it's severe respiratory compromise. So I want to know, how ill is this person? And it's the same thing even with the flu. I don't necessarily want somebody with the flu coming into my office. So I'm going to tease out over the phone doing that triage, how sick are you? And well, you got a little great fever, you're coughing, you're achy, but otherwise that, stay home. There's really no benefit to coming in. You're coughing really bad, you're having some dyspnea, shortness of breath, you probably need to be assessed.
I agree with you. I think I recently went to the doctor's office for another problem, and one of the first questions they asked me is, are you ill? Do you have a fever? And then, have you traveled outside the country in the last 30 days? And I'm like, well, those are really good questions to ask. And so I agree with you. We should do a better job in training our staff and triaging phone calls and encourage people to stay home and take care of themselves and see those who are most vulnerable, those who've been exposed, those who are elderly, those who are immunocompromised. Let's say the patient gets through the gauntlet of your front desk, is in your office, and they've got some fever, they're achy all over, maybe a little bit of a runny nose, a little bit of a cough. How do you decide whether they should be tested or not?
So first thing I want to say, when they come in, they should put a mask on. You should ask them to put a mask on. The other thing is really being careful with careful hand washing. This particular virus is droplet spread versus airborne, which is interesting. So airborne, people are sneezing or whatever, gets into the air, it floats around for a couple of hours. Being droplet spread means that it settles more on surfaces, environmental surfaces, hangs around probably 3, 4, 5, 6 hours. So careful hand washing, but also for that person who is coughing to cover up so that they're not coughing. And I'm sorry, what was your question you asked me?
I asked, how do we decide whether we test them or not?
Oh, so great question. So it turns out you really can't test them. Your local hospital doesn't have the testing. And up until just very recently, like last weekend, it was only the CDC that you can get testing. So you'd have to send a test. Now, mind you, you've got people coming in with respiratory symptoms that are ill. All right. So you want to know, you want to do a respiratory swab for them, and you want to test them for RSV and influenza. And that's probably what they're going to have. But then you can take that swab and you can send it off for testing. Now, right now, most state departments of public health have the kits and they're able to do the testing, but they're not testing everybody either. What they're testing is only people who are actually ill enough to be in the ICU. And so the CDC won't even accept a sample unless somebody is severely ill. So this is what I said. Right now, it's really around people who are sick and ill, they need to be admitted. They need to be in a reverse pressure isolation room as part of it. So we want to keep these people home as much as possible. We want to keep them out of our ears, out of our offices, and say, at home, you should just take care of yourself at home and to prevent the spread of this illness until we've really developed a bigger sense of herd immunity or vaccine to help.
Let's just end on sort of a broader picture. What are your thoughts going forward? I've heard a number of predictions that, eventually this is such an infectious agent, most of us will probably be infected with it, but hopefully by then we'll have a vaccine to help prevent it. Any thoughts on that?
Yeah, so one of the issues is being concerned around what's the mortality rate. And so the mortality rate appears to be somewhere between 1% and 4% looking at this, but that all depends on what the denominator is. So many people have this, it's like the common cold, and we don't know how many people actually are out there. So if you look at that denominator, it gives you a different factor. For influenza, the mortality rate, I think, is 0.1%. And so it's a much lower mortality rate. By the way, we've had about 10,000 deaths this year from influenza. And it's going to be over, I think, 10, 20 million cases of influenza this year in this country. So that's also something to keep in the back of your mind. And mostly what we're seeing still when we test people is influenza. It's not this the coronavirus. I was hoping that maybe this would die out as the weather gets warmer, which tends to happen with the influenza virus. Well, it turns out, Frank, you've heard about summer colds, right? You know what causes summer colds? Coronaviruses.
Wow.
So the likelihood of the warmer weather is probably not going to help us with this particular strain of coronavirus that we're seeing.
All right, so encourage patients to stay home, take care of themselves, wash your hands frequently, and stay tuned. We'll try to give you an update going forward over the next couple weeks as we learn more about the coronavirus and how best to help you and your patients. Thank you, Bob.
All right, thank you, Frank.
Practice pointer. Patients who call and are ill should be encouraged to take care of themselves at home unless they're severely ill, immunocompromised, or elderly. Those should be seen in some healthcare setting, either your office or an emergency room, and they should be encouraged to wear a mask before going into any healthcare facility to prevent further spread of whatever illness they have. Join us next time when we talk about intermittent fasting and its influence on weight loss and improving cardiac risk factors.